I'm a lifelong Republican and I'm pro-business.
I'm a Georgian and I believe in personal responsibility.
I'm a Georgian and I rely on my Social Security and Medicare.
I am a mother and I believe in immigration policies that support family unity.
My party is not fiscally responsible anymore.
It's irresponsibility that's costing us our lives.
It threatens my Social Security and Medicare.
It is keeping our families apart.
That's why
I am
I am
voting Ossoff and Warnock.
ఎక్స్చేంజ్ 8,000 రూపాయల బ్యాలెన్స్ మ్యామ్.
ఇవ్వనక్కర్లేదమ్మా, 8,000 మీకే వస్తాయి.
ఎస్ మ్యామ్, మేము కేవలం హాల్మార్క్ 916 గోల్డ్నే అమ్ముతాం. ఇంకా మీకు దొరికింది 100% ఎక్స్చేంజ్ వాల్యూ.
క్వాలిటీ, ఇది మలబార్ ప్రామిస్. ప్రామిస్ ఇస్ ఎ ప్రామిస్.
ఇది మా హీరో అల్లుడు కోసం ఫిట్ గా ఉంటుంది.
పర్ఫెక్ట్ గా ఫిట్ అవుతుంది. ఇది మైండ్ డైమండ్, 100% క్వాలిటీ.
సార్, ప్రతి మైండ్ డైమండ్ న్యాచురల్. ఇంకా మేము 28 క్వాలిటీ టెస్ట్లు చేస్తాం.
28 టెస్ట్లా?
ప్రతి డైమండ్ జ్యువెలరీతో పాటు ఇంటర్నేషనల్ ల్యాబ్ సర్టిఫికేట్ కూడా.
కళ్ళు మూసుకుని మీ హీరో కోసం వజ్రాలను తీసుకోండి. ఇది మలబార్ ప్రామిస్. ప్రామిస్ ఇస్ ఎ ప్రామిస్.
Hello viewers of Healthline on TVASIATELUGU channel. This is your host Varsha Singh and I'm here again with another special guest from Sathi group. Sathi means South Asian Total Health Initiative. The aim of Sathi is to empower community through health education and conduct clinical research within South Asian community. So far, we have met a couple of Sathi physicians and Sathi leaders, and we have listened to their advices and their experiences working in the South Asian community in United States of America. Today, I have a special guest again, and this special guest is Dr. Maya Ramagopal. Dr. Maya Ramagopal is a specialist in pulmonary medicine, but she is a pediatric pulmonary medicine specialist. And also she holds a specialization in sleep disorders. Dr. Maya Ramagopal, she is also a professor in the Rutgers Medical School, that is Robert Wood Johnson University Medical School. And she is also the medical director of pediatric program at the Comprehensive Sleep Disorders Center, a joint program of RWJUH and RWJ Medical School. Dr. Maya Ramagopal is a graduate of medicine. She has done her medicine in India from Jawaharlal Institute of Postgraduate Medical Education and Research in Pondicherry, India. And since coming to United States, she has completed another pediatric residency at Fletcher Allen Healthcare, University of Vermont in Burlington, Vermont. I just wanted to get everything right. Dr. Maya Ramagopal is going to share a couple of things with us today, which are really important to our pediatric population. So I'm sure there are a lot of parents in our viewers who are watching this show right now, and you may have so many questions that are popping up in your mind right now. And Dr. Maya Ramagopal is here to give you her perspective of what is pediatric pulmonary medicine and what are those sleep disorders that we should be aware of, especially in pediatric population. And then she's also going to give her expert opinion on the most current concern of all of us, which is COVID-19. So please join me in welcoming Dr. Maya Ramagopal. It's such a great pleasure to have you here.
Thank you so much, Varsha.
So to begin with, Dr. Ramagopal, Every time we bring a Sati physician in this show, and we talk about all the Sati initiatives and how Sati physicians are working really hard to bring the best practices as well as the most current knowledge to the community members. So far, we have limited ourselves to health fairs or in-person conferences, and this is first time that we are using a mass media, actually TV shows such as Healthline on TV Asia Telugu channel, to get our message out there. So my first question to you would be, Dr. Ramagopal, tell us about your journey and how did you join Sati? So we can learn about you and your relationship with Sati.
Okay. Well, I have been at Robert Wood Medical Center, Johnson Medical Center since 2006, and my specialization being pulmonology and sleep medicine. I have been seeing patients with several conditions that pertain to that, and asthma is a big one in children, lung problems. And you know that New Jersey has a substantial South Asian population, and we have several patients who come into our clinics with not just pulmonary problems, also sleep-related problems. And then I came in contact, of course, with Dr. Sunanda Kaur, who heads Sati, and she is very interested in research. So we said, there are some very unique features about specifically asthma in this population, and we have decided to actually study that in a more systematic way. I also just want to tell you about a recent study that I did with not just Dr. Gore, with also a medical student at the time. And we decided to research the question of using, complementary medicine in asthma, both in the South Asian population as well as the Hispanic population, because there is a sizable Hispanic population as well that comes to our clinic. So we thought this would be, two good comparison groups, and we posed the same questions to them about basically what are their health beliefs about asthma, what do they even think asthma is caused by, and how best to treat it. And what we found, interestingly, is that both of these ethnic groups actually use a lot of complementary medicine in their treatment of asthma. But the Hispanic people were not as willing or forthcoming with that information compared to, how the South Asians are. So actually my message to your audience will be, I think, it's quite prevalent, the use of complementary medicine in treatment of asthma. But it is really important to tell your physician that this is something that you have been doing. I think a lot of patients are very reluctant to share this information with their doctors for whatever, several reasons, I would say. And also I think it may not even occur to some people that this is, something that should be shared with a doctor. To the physicians in your audience, I would say that please ask about this, because we all know as healthcare providers that unless you ask for something, that information is not always forthcoming. Because sometimes seemingly innocuous therapies may be interfering with something else. So it's always important to be forthright about all the medications or therapies that are being used for this reason.
Thank you, Dr. Ramagopal, for making a really important suggestion and giving those messages to our community members so that they really pay attention to what you have to say, what is coming next, and they are really aware of what it entails into taking charge of their own health. At the same time, understand what a researcher, faculty member for the medical students, as well as a specialist with an expertise. And let me mention, Dr. Ramagopal has authored a chapter in the textbook, which was edited by Dr. David Gozal, and which is published in 2020, correct?
Yes.
Yes. And Dr. Ramagopal has lectured nationally as well as internationally, and she has presented at Respicon, which is a really reputed conference for pulmonologists. So, Dr. Ramagopal, this is the burning question, and I really want to have this advice and explanation coming from a specialist such as you for our community member to understand what exactly is asthma and why everyone is so much worried when they hear that word asthma, especially in pediatric population.
Thank you, Varsha, for asking me that question because this is very important. So basically, I think I want to start off by saying asthma is the most common chronic illness in children. Just to give you an idea of some fast facts, like every day in America, there are 40,000 people who miss work because of asthma. There's 30,000 people who have an asthma attack. There's 5,000 people every day that go to the emergency room because of asthma. And there's 1,000 people who get admitted every day because of asthma.
Wow.
And the saddest part is 11 people a day die because of asthma. So, and asthma is, if you look at the health expenditure nationally, asthma is up there. You would think that cancer or some other, sort of expensive in that way illness is going to be, but asthma, because of how common it is, it is an expensive disease. So asthma in children is, it's basically a disease, it's an inflammatory condition of the lungs. And I will explain that to you in a slide. Maybe if you can put up slide 1. So in this slide, there's a normal airway and an asthma airway. Okay. And you can see the difference between the two in how much more open the normal airway is compared to the asthma airway. So because of the inflammation, there is mucus production. So that's why the cough sounds wet. There is constriction of the smooth muscle. That's why the airways are more narrow. And because of all these factors that are ongoing, it's much more hard to get the air in and out. So that results in symptoms like coughing, wheezing, shortness of breath, chest pain, and just difficulty doing, regular things, including sports activities.
Dr. Ramagopal, thank you for such a beautiful visual. This really explains, like, how in common man's language we can say that we can blow air through a bigger tunnel, and then the air has really difficulty passing through narrow tunnel. So this is a really great visual for those who really do not have medical background or medical knowledge. They can really understand it. So thank you for sharing that. So the question is, when someone has this condition, especially in pediatric population, what are those risk factors, or is there a precursor, or is there a kind of genetic component, or is there an environmental component that can make children prone to this kind of condition?
Yes. So asthma is an interplay between the environment, the genetic predisposition, and the innate immunity of the child. So the genetic factors, so if the parents have any of atopic conditions, by which I mean asthma, eczema, or allergies. So those three together are called atopic diseases. So if there's any one of those, the chances of the child having asthma is that much higher. So if one parent has it, obviously the risk is not as much as if both parents have it. If the child herself or himself has eczema, if in the newborn period or even in infancy there is a history of milk protein allergy. So those are sort of things to watch for. So things that might lead on to the child having asthma. So the thing about asthma is it is an episodic condition, so you may not have symptoms all the time. So I'll often tell my patients and my parents, it is a chronic illness. We know that. It's like when you have to treat hypertension, which is a chronic illness, you have to take daily medications to keep your blood pressure on the check, right? So similarly, you have to treat your asthma every day, even though you might be feeling fine. Because commonly what happens is once the child feels better, the medications are stopped. So there are several triggers also in asthma, and I have a slide number 2 for the triggers. So these triggers are environmental, which can be, outdoors or indoors. The indoor commonly seen are dust mites, which are seen in the carpets, in the pillow covers, stuffed animals in younger children. They grab dust and hold on to it. Those stuffed animals have probably never been washed, So basically, the recommendation for that is wash your bed linen, bed sheets, pillow covers every week, but it has to be in very hot heat. So make sure if your washer settings are at least 130 degrees, because less heat doesn't really kill them. Vacuuming, of course, is because the carpets also have it a lot. Of course, there are pets. A lot of people are allergic to, cats, dogs, ferrets, rabbits. There's several, little pets that can cause the allergies as well. Pests like cockroaches can be a big trigger. Outdoor allergens, of course, are trees, grasses. Those are the common ones. The other triggers can be weather change. So the change of season is often a big trigger. Sudden change of temperatures, exercise, emotions, irritants like secondhand smoke. And I want to tell your audience that this includes vaping. Because now that's the new thing.
Yeah.
And chemicals like cleaning things, if it's very strong, that can be a trigger. Perfumes. So basically, those are the triggers.
Wow. I'm just listening to your list of triggers, and it seems like we are surrounded by many, many triggers. At the same time, when I'm listening to you, and I know that it's going to be our further conversation, that in spite of having all these triggers that can invoke an attack or an initial reaction in small children, there are ways to manage it. And I know that is the further discussion coming. But I really want to ask, because this will be some questions popping up in our viewers' mind, that how far can this attack or asthma first episodes, are there any preventative that we can control the environment in such a way that to some degree you can reduce such incidences?
Yes, it is, of course, not very easy to control the outdoor environment. But indoors, certainly you can reduce the dust mite burden by, like I said, regular washing, vacuuming, if it's possible at all, to remove the carpets. That's even better. Stuffed toys, we found, is a huge trigger in little children that, we often don't think about it. But, little kids like to snuggle up with their stuffed toys, and that can be a trigger. Pest control, of course, and even, make sure that the cleaning agents are not so harsh. So that is, one way to control your triggers. But of course, the key thing is taking your medications regularly.
Okay. So going forward, how do you diagnose when you say that, yes, I have examined your child and I have these findings and I am making a diagnosis. So this is the criteria on which you will really definitely say that this child has asthma. How do you determine that?
So asthma is still a diagnosis that you can make based on history. So the parent might say, this child gets a cold, but the cough seems to last, 10 days to 2 weeks, while my other child's cold symptoms improve in a week. The cough can be mostly at night. It is because of certain triggers, like, the change of season causes the symptoms. And sometimes they might have gone to the doctor or even the emergency room and have been prescribed a nebulizer or an inhaler called Ventolin, which improves symptoms. So if they give you a history like that, that is very suggestive of asthma. If the child is over 5 years old, we can do pulmonary function testing, which is on slide 3. So basically, that is a test that we use only for 5 and up, because they have to be able to follow directions. So that test gives us an idea about what the state of the lung function is at the time. We can compare it to what is normal and see where the child's results fall and make a determination as to what is going on. Following that, if we administer albuterol and see that the results improve, that is another pretty sure way of making that diagnosis. There's also things like peak flow meters that patients can do on their own at home. And if because sometimes what happens is patients don't really feel their symptoms. They're not even aware that, something is going on in their lungs. They are what we call poor perceivers. In those instances, they can follow their peak flow and see if that has reduced, and that should alert them that something is going on.
Okay. I think our viewers have now a clear idea, and they understand that it requires a lot of factors that you consider before making the diagnosis and offering a treatment plan. So, Dr. Ramagopal, in your practice, you have seen many patients. What is the most typical presentation when they bring the child for the first time?
The typical presentation is coughing and wheezing that is recurrent. So every time there's a cold, it's the winter typically, the symptoms just don't seem to be getting better. They are prescribed albuterol, which is a short-acting beta agonist. Basically, what it does is very temporarily take care of the symptoms, but it doesn't address the underlying factor. So therefore, the symptoms are very recurrent. So and of course, they may have other very commonly associated factors such as eczema, such as allergies. Another risk factor is snoring, which may or may not be obstructive sleep apnea, but that also needs to be looked at, because if that is present also, these symptoms are harder to treat. Another important factor is your weight. So if the higher BMI, the harder it is to treat. So that, we have to look beyond just the lungs to, address other factors that could impact the treatment.
ఎక్స్చేంజ్ 8,000 రూపాయల బ్యాలెన్స్ మ్యామ్.
ఇవ్వనక్కర్లేదమ్మా, 8,000 మీకే వస్తాయి.
ఎస్ మ్యామ్, మేము కేవలం హాల్మార్క్ 916 గోల్డ్నే అమ్ముతాం. ఇంకా మీకు దొరికింది 100% ఎక్స్చేంజ్ వాల్యూ.
క్వాలిటీ, ఇది మలబార్ ప్రామిస్. Promise is a promise.
Mom, what did the man mean when he said go back to where you came from?
Go back, wherever you're from.
Why do they make fun of my name at school? Dad, who will protect us from climate change?
Global warming, and a lot of it's a hoax. It's a hoax.
Why is Mommy coming back from hospital?
Our family's future is at stake. The choice is ours. Vote Asaf and Warnock.
ఇది మా హీరో అల్లుడు కోసం ఫిట్ గా ఉంటుంది.
పర్ఫెక్ట్ గా ఫిట్ అవుతుంది. ఇది మైండ్ డైమండ్, 100% క్వాలిటీ.
సార్, ప్రతి మైండ్ డైమండ్ న్యాచురల్. ఇంకా మేము 28 క్వాలిటీ టెస్ట్లు చేస్తాం.
28 టెస్ట్లా?
ప్రతి డైమండ్ జ్యువెలరీతో పాటు ఇంటర్నేషనల్ ల్యాబ్ సర్టిఫికేట్ కూడా.
కళ్ళు మూసుకుని మీ హీరో కోసం వజ్రాలను తీసుకోండి. ఇది మలబార్ ప్రామిస్. ప్రామిస్ ఇస్ ఎ ప్రామిస్.
I'm really interested in learning more about, and I'm sure our viewers will be interested as well right now. You said something about sleep disorders, and I know that sleep apnea in adults, it's highly prevalent, but in children, the sleep apnea, if you can elaborate a little bit more about it, because sometimes this can be not considered as kind of a disorder when child is snoring, coughing at the same time, or the BMI. And I know that our USA or the New Jersey community members are well aware, and they are taking children to their pediatric visits regularly. But sometimes if they are missing that awareness, then it will not be addressed. So if you can let us know, what are those really features about sleep apnea that every parent should know?
Okay. Yes, that is very important. And also, I think, like you mentioned, kind of under-recognized that it is a problem. Oftentimes when, I ask my patients, oh, do you snore? There's always a little bit of a giggle, and because they think it's rather funny, and they say, no, I don't snore, it's dad, or, mom that snores, but it's never the kid. But that's what we know is up to, the statistics are different from various parts, but on average, there's 7 to 10% of children who actually snore. So just because you snore doesn't mean you have sleep apnea. Out of those children, about 1 to 2% actually have sleep apnea. And what that means, apnea means a pause in breathing. So the history would be the child is snoring, there's a pause, there's a gasp at the end of it, and then, the breathing continues. So the other sort of telltale signs are, maybe the child might be a mouth breather, a restless sleeper, sometimes use more than one pillow, several pillows, sort of to keep the neck hyperextended and sort of help the breathing. And basically, the interesting thing is, that is different from adults, is you don't find daytime sleepiness as much of a problem in children. Now, this is most common in sort of your preschool and early school age groups. You can find it in any age, of course, but that is sort of the peak. And that is because it's most commonly due to enlarged tonsils and adenoids in this age group. And it is big in relation to the size of the airway. And that's why you sort of tend to see it at this age. So, if parents are, seeing that, they should definitely bring it up with their pediatrician, because this can have, we now know that it has consequences on learning. It can cause blood pressure problems. There's all kinds of problems that hyperactivity. A lot of times these children get picked up from the ADHD and neurology clinics. And, all the time it's just because they're not getting restful sleep. It's fragmented sleep because of the snoring. That gives rise to the daytime symptoms like hyperactivity.
Thank you so much for sharing this, because not many parents know about this. And as personally, I know what can happen to me if I did not sleep properly. I will be non-functional next day. So I hear a great concern, anyone with sleep apnea, especially children. I agree with you that they really need to have at least a screening to have a proper diagnosis. So going further in this discussion, Dr. Ramagopal, we talked about what is asthma and how you diagnose, and also sleep disorders in children. So what are the treatment options, and what are the newer technologies or newer treatment options that are in the market right now?
So the mainstay of treatment for asthma is inhaled steroids. Now, parents get very alarmed when you say, oh, this is steroids, I'm recommending you take this on a daily basis. But the thing to emphasize, this is inhaled. This is going to stay in the lungs. It doesn't get absorbed in the blood and, have all the side effects that prednisone, which is a systemic steroid, has. So basically, I, told your audience earlier that asthma is inflammation of the lungs. So what that inhaled steroid does is it acts on the inflammation on the surface of the lung. The inflammation gets better. The size of the airway improves because the swelling comes down and the symptoms resolve. There are a variety of steroids in the market, and I think I have some slides to show that. There are combination inhalers that include both the steroids and the bronchodilators. There's different devices that you can use this with. And I also want to emphasize that these inhalers should be taken with a spacer. There are some devices that you do not need the spacer for, but for little kids who cannot really coordinate it, we strongly recommend use of a spacer. And the reason for that, also I have it in a slide, that if you use the inhaler without a spacer, the medication is mostly deposited in the mouth, in the throat, and in the stomach. Now that's not where the medicine needs to go. So with the spacer, it gets streamlined and it goes directly into the lungs. And this applies even to the adults.
Oh, that's a great technique, and that's a great advice. Thank you so much. So you are going to say a little bit more about the newer treatment?
Yes. So, there comes a point where, asthma is what we call severe asthma. It doesn't get controlled even though we have the child on maximum doses of inhaled steroid. We have other medications that we can use, and if they still are having symptoms, there is a medication that your audience might have heard of as Xolair. So what Xolair does, and this is good for allergic asthma. So basically, I should have said that in the beginning. There's two kinds of asthma. There's allergic asthma, there's non-allergic asthma. And in children, it is mostly the allergic asthma. So there is a substance called immunoglobulin E in our body, and that is elevated when there are allergies. So what Xolair does is it binds to the IgE, and if there's no IgE, you don't really get symptoms. So there's another cytokine called IL-5, which is also responsible for symptoms, and that is another target that a different medication, Nucala, does work against that. So these are in the form of subcutaneous injections that we use about approximately every 2 to 4 weeks. So they have to come in and get the shots. But the good thing is, they have been able to reduce the amount of inhaled steroids that they've been using. And I actually have a patient right now who was in the hospital every few months. She was coming in. I had her, and this is a 10-year-old girl. I had her on maximum doses of inhaled steroids. I had to give her several courses of prednisone. And they were very, very reluctant to start on the Xolair. They said, oh, we cannot come every 2 weeks. It's a shot and this and that. But she's been on it for about 6 months now, and this is a new kid. She said, oh, I didn't know I can breathe so well, So there are other medications that we have, but obviously you have to meet the criteria for severe asthma. It's not for every asthma patient, but it's there.
It sounds so relieving just to listen to that one patient story, breathing easy. That is such a great relief to someone who has not been able to breathe with ease. Mm-hmm. And I can actually put myself in that spot and that really go through that. It was really the visual that you presented So it's actually also a relief to many who are watching that yes, there is an option, and there is not a wall, and there is always a new technology coming, which is making it easier and easier to manage the disease. So we talked about the newer technology and newer treatment in terms of what the pharmaceutical companies have offered through the mainstream medication that we call it, through the pharmacy and the chemical component. But you mentioned in the beginning of your presentation, when we started, you mentioned about the natural and alternative treatment for asthma. And as a pulmonologist and as a pediatric pulmonologist, you have found them effective. I am requesting if you can share a little bit more and in detail, because it will make a great impact on our viewer to hear it from you.
So there are, I would say, at least in the South Asian families that I talk to, almost all of them have tried some kind of a natural remedy for asthma. And I guess the good thing is that South Asian food has a lot of antioxidants. You know, we use turmeric in our food, ginger, you know, so those are the main, spices that we use. We also have foods that are fairly high in antioxidants, green vegetables, lentils, fruits, strawberries, blueberries, things you get here are very rich in antioxidants, and those are very good for, inflammation in general. So other than that, there are also practices that, are commonly seen in South Asian families, such as yoga and breathing exercises. So those are definitely beneficial. Pranayama is definitely has seen to improve your breathing capacity, and they don't exactly say that in the studies that have actually been done that the asthma symptoms improve, but the lung capacity definitely improves. So it is absolutely fine to do that, but as an adjunct therapy. It should not take the place of your inhalers, for example. So I would caution your viewers to, by all means, do the yoga, do the asanas that you practice, but don't give up on your inhalers as well.
Yeah, that's really important, because the main treatment option is the medication, the inhalers, as you said, and topping it off with yoga practices or breathing exercises, it can have a synergistic effect. It will add on the benefits of the medication that a child is taking right now. Mm-hmm. Dr. Ramagopal, can you share a story that is really close to your heart, because I'm sure you have many stories and many patients that you have treated in so many years of your practice.
So do you want South Asian stories? I can tell you a few of those actually, which are, might be pertinent to this audience. So there was a research project that I was involved with in the with the environmental school at Rutgers. So we were looking at the indoor environment and the child's respiratory symptoms. And this was done in kids from 1 to 3 years of age, really little kids. And this was a really cool project, I have to say. There was a little robot, and his name was Piper. And you could program him to move like a 2-year-old girl or a 3-year-old boy. And, because they had so much data about how many, how much of the waking time the kid spends on the floor, walking, etc. Because another concept is that we often forget is the air that the child is breathing is actually, a 3-year-old breathes different air than what we breathe, right? Because they're closer to the ground. And when they move around, they resuspend the dust, and they keep breathing that same resuspended dust. So this robot was, sort of simulating the child in the home and collecting, dust and dust basically from the period of time that the robot was there. And there was one home they went to, and they actually called me from there, and they said, "We're in your patient's home, but Piper has stopped working." I said, "What happened?" They said there was so much incense in the home that it actually clogged the filters and, actually stopped working. So then come to find out that that particular child had very, very severe symptoms, and I didn't realize that there was a trigger like the incense burning that was not letting him get better. I didn't think to ask. The family didn't think to tell me. And if Piper hadn't gone there and figured it out, and I counseled them on that, we would have never known. So, it is so crucial to find out what exactly is going on in the environment of the child, because that can be so key to making that child feel better.
Wow, that is such an interesting story. Really interesting. Like, we would have never found out that if that robot had stopped working because of incense. And it's a very common practice in many households, because we all are culturally and religiously, it's part of our culture to light a lamp and light an incense. And we know that now we are living in a different kind of environment too. If you look at our houses, the windows and doors are not open all the time. So that's a great and interesting story for many to take a few points from that. And what I really want you to talk about is naps and nibbles.
Okay. So Naps and Nibbles is a program that I did with a colleague, a pediatric pulmonologist colleague in Bangalore. And that came about because, people were, and, this has been known, we've talked about sleep training in the United States for a very long time, but that is sort of a relatively new concept in India. Because, the family structure over there has been changing. They are no longer in multi-generational families like it was, a couple of decades, maybe a decade ago even. So now with both parents, working, everyone's strapped for time, the child's sleep is become an issue. There doesn't seem to be as much of a structure like there was. So, he was getting questions about, what should I do? My child's not sleeping. How can I get into the routine? What should I do about, sleep, making the child sleep in, his bed or her bed and not want to come, the behavioral problems that are associated with the young child's sleep. So we made a little video for parents and also to educate pediatricians about what to do when they are confronted or they are being approached with a problem that's becoming increasingly more common. And this was very interesting because we also had to make it sort of culturally suitable. We couldn't just make the recommendations from here and sort of transfer it there. So we put our heads together. We said, is this going to work? Is the cry it out going to work? No, that's not going to really work in that setup. So basically it's about, problems, not just sleep problems. We have some educational things about feeding in infancy and young children also, which can be, they don't say terrible twos for nothing. There are problems with, eating as well. So how to just go about that in sort of a culturally sensitive way is what Naps and Nibbles is all about.
Oh, thank you, Dr. Ramagopal. I can listen to you forever. So finally, I know that there are children who are growing surrounded by environmental pollution. And we know that we have this pollution issue, environment issue. And in spite of that, there is an opportunity to stay healthy by seeking the right treatment. And I believe that after listening to this, our viewers will pay attention to their own environment and how they can seek consultation with appropriate specialist. And I know that you have done so much in this field. You have written chapters in textbook, you have spoken about it, and I'm sure you have educated community members every time you see them in your clinic. And through your research, you will be bringing some new data out, especially for South Asian as well as Hispanic community. So I'm sure that we will be talking in future when that research is completed and when you will have more data to share with our viewers. So finally, when we are ending this session, what would you like to say to our viewers?
Thank you for giving me the last word opportunity, but I do want to tell your audience to please, bring the symptoms that you have to the attention of your healthcare provider. And there are several misconceptions about asthma, that asthma is sort of a debilitating condition. That is not the case. It is, we are able to manage it very well. And children can go about, and even adults can go about their daily life without any kinds of restrictions. We do not give them letters to sit out of gym or, take the elevator in school. No. You get your treatment, and asthma is very, very manageable. So it's not something, I know some people have this idea that, if you have asthma, that's the end of it for you, but that is not at all the case. So please don't feel, delicate, if you will, to bring this up, because we have medications that can help. Also, snoring is a symptom of something else that might be going on. So please also bring that to the attention of your healthcare provider.
Thank you so much for your time and sharing your expertise with us on Healthline on TV Asia Telugu channel. Dr. Maya Ramagopal, I would like to say a big thank you and hope to see you again in future on our show. I'm saying good night and bye for now to our viewers. Don't miss our next episode, because we will be bringing another Sati physician in this special Sati series on TV Asia Telugu channel. So I'm saying bye for now. Your host Varsha Singh. Take sleep. See you again. Don't miss our next episode.
ఎక్స్చేంజ్ 8,000 రూపాయల బ్యాలెన్స్ మ్యామ్.
ఇవ్వనక్కర్లేదమ్మా, 8,000 మీకే వస్తాయి.
ఎస్ మ్యామ్, మేము కేవలం హాల్మార్క్ 916 గోల్డ్నే అమ్ముతాం. ఇంకా మీకు దొరికింది 100% ఎక్స్చేంజ్ వాల్యూ.
క్వాలిటీ, ఇది మలబార్ ప్రామిస్. ప్రామిస్ ఇస్ ఎ ప్రామిస్.
ఇది మా హీరో అల్లుడు కోసం ఫిట్ గా ఉంటుంది.
పర్ఫెక్ట్ గా ఫిట్ అవుతుంది. ఇది మైండ్ డైమండ్, 100% క్వాలిటీ.
సార్, ప్రతి మైండ్ డైమండ్ న్యాచురల్. ఇంకా మేము 28 క్వాలిటీ టెస్ట్లు చేస్తాం.
28 టెస్ట్లా?
ప్రతి డైమండ్ జ్యువెలరీతో పాటు ఇంటర్నేషనల్ ల్యాబ్ సర్టిఫికేట్ కూడా.
కళ్ళు మూసుకుని మీ హీరో కోసం వజ్రాలను తీసుకోండి. ఇది మలబార్ ప్రామిస్. ప్రామిస్ ఇస్ ఎ ప్రామిస్.
Sunshine Wealth LLC. Conquer your financial future.
We came to this country with big dreams. We have been working day in, day out. Our big dreams seems impossible to reach. Let's not give up hope. Let's work together to create your financial freedom roadmap. We care about you. We care about your future.
For more details, log on to www.sunshinewealthllc.com or call 848-391-9338.